All right. Well, good morning, everyone. It is a fantastic Monday morning here at Health Plan Markets. It is 9:02 a.m. on July 24th. Thank you all for being here live in person. And we are back at it. So, as we normally start, we always start with why we are here. We are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. Thank you for helping our community find healthcare because without health, we have nothing else. So go out there and help people, right? But in order to help people, we've got to be smart. We got to know what we're talking about. We've got to be educators. We've got to be experts. We have to know what's going on. So, again, thank you for being on these calls. We know as we get closer and closer to AEP and open enrollment, for those of you that are doing ACA business, it's going to be increasingly important that you have the most up-to-date information because you don't want to go into AEP without the right weapons and information at hand. So with that, we are going to do our training calendar as we do every morning on Mondays. And the reason why is because we got to have one foot in the classroom and the other one in the field at all times. So training this week, obviously we're in the call now. Later this afternoon at about 1 o'clock, we've got United Healthcare doing their DSNP training. So if you're interested in learning more about their Medicare and Medicaid products, DSNP Basics is at 1 o'clock today. I will tell you that this is our #1 selling DSNP product right now across the country. If you're not selling United Healthcare DSNP plans, please make sure you know at least what you're up against because they are our #1 selling product at this agency. All right, moving down. Later today at 4 o'clock, you've got Devoted doing their marketing storefront training. This is pretty awesome. They have their own marketing portal and assets that you can download and use immediately. It's already pre-approved. You can customize these marketing pieces such as flyers, Facebook ads, social media posts, pull-up banners, all sorts of cool stuff. We're meeting later today with Devoted to talk more about that. But at 4 o'clock today, you can get a training on how to use their storefront, which is really cool. So that's available at 4 o'clock today. Also at 4 o'clock is United Healthcare's virtual office hours. So if you have any questions or concerns about United Healthcare, that is available today at 4 o'clock. Moving on to tomorrow, the 25th, another storefront training for Devoted at 12. So if you can't make the one at 4 o'clock today, the other one is at 12 o'clock. All right, moving on to Wednesday, 9:30, we've got Ask Al, our very own Al Clancy, our guru trainer, and our director of training and compliance. He is at your disposal 9:30 virtually. He's not a robot. He's a real person. It just means that you're in one place and he's in another. But you can have a coffee and chat session with him. He is the real deal. So if you have any questions, if you're lost, if you're not really sure what the next steps are for anything here at Health Plan Markets, we want to make sure that you're not lost, confused, or overwhelmed. Al is at your fingertips 9:30 on Wednesdays. Okay, so the link is there. Click that, and you can connect with Al at 9:30. Wednesday also, Devoted is doing their breakfast and AEP sneak peek. This is one of the first ones that's out there, so you can visually see what's going on with Devoted Health for 2024. Very important that you know what's going on. They do have one expansion area in Florida, and that's up in the St. Augustine area. If you're doing business up there, they're expanding there. But they're not expanding into other states. They're just expanding externally. So if you're in different areas of the country, you know, this is a good opportunity for you to go in there and check out the training sessions for Devoted. These are the sneak peeks. They will be giving you a preliminary view of what the benefits will look like for 2024. Now, little asterisks here for everybody. The benefits that you see have been filed with CMS, so they've been sent in, but they may or may not have been approved yet. So they could change between now and October 1st, okay? The benefits that you see in the sneak peek could change between now and October 1st. So just keep that in mind. And remember, you are not allowed to talk to your clients about 2024 benefits on Medicare until October 1st. I know you're talking to your members now. I know they're calling you, thanking you for your birthday cards, or they might have an issue. What you see during the summer, you are not allowed to talk about it until October 1st. Okay, just keep that in mind. I don't want anyone getting in trouble for that. Okay. But this is for your mind, so you can start calculating who's going to be on what plan as you think about your members and your clients for 2024. Okay. So the first sneak peek is on Wednesday. This one's in Winter Park, and that is for devoted 10 o'clock on Wednesday. So be there or be square. Also on Wednesday, you've got the 11 o'clock session for Cigna's virtual office sessions. This one's for Medicare. So if you have any questions about Medicare for Cigna, they are available. And by the way, guys, these virtual office sessions are available to anyone, anywhere in the country. Okay, so if you're in Georgia, if you're in California, if you're in New Jersey, doesn't matter. You can call these same numbers. Florida, doesn't matter. They're here to help you. Okay. Moving on to Thursday, we've got Humana doing Beyond the Copays. Not sure what that one's about, but if you want to learn more about Humana, you can check that out. That's at noon on Thursday. Also on Thursday, we've got the Florida Panhandle sneak peek, and that looks like for devoted as well. So if you're doing business in the Panhandle or you're up in the Panhandle, you might want to check that one out. Also on Thursday, thank you, Cindy, for the reminder. It looks like we've got our benefit advisor meeting. That's at 3 o'clock. I don't have the details on our training calendar. So if Cindy and Al can put that on the training calendar, that would be super helpful for us. But we do have that on Thursday, the 27th at 3 p.m. Those of you in the Orlando market should have gotten an email, text message from Cindy in regards to that meeting, and you may even get a phone call this week just to remind you that we would love to have your attendance on that. These are very important benefit advisor meetings. We want to ensure that you're getting the information from our partners quickly and often. Okay. Last session, I will say, on the benefit advisor meeting, we had an incredible training. Al was teaching us how to do tabletop marketing, and we had some all-stars and superstars show off their tables and what works for them when they're doing tabletop sessions. And everyone left with some amazing ideas and some great success stories. So I was really proud of the team for putting that on, and we're doing it again this Thursday at 3 p.m. So check that one out. Last training of the week is Friday the 28th, 3 o'clock. United Healthcare is doing their virtual office sessions. So it's a little light on the trainings this week, and that's because but last, just a shout out to Mr. Tom Ryan. His birthday's on Saturday, so if you bump into Mr. Tom Ryan, wish him a very, very, very happy birthday. All right, let's jump over to recertifications. We were talking about that in just a minute ago. We have, as a reminder, our gold key, which is your knowledge center. This is your brain. This is where you find all of the answers for everything that you need to do this business. If we're missing something, please let us know. But the most important thing right now is recertifications. You need to recertify for all of these carriers. If you have offered any of the products in 2023 and you got certified, you need to recertify. If you're new to the carrier, you need to request a contract. And after the contracting has been completed, you'll receive onboarding instructions for 2023 and 2024. Okay. Now, most carriers, not all of them, but most carriers, when they roll out their 2024 recertification instructions, this will be good for 2023. So if you didn't have a specific carrier, let's say, for instance, you're new to Healthfirst, as an example, and you didn't offer them in 2023, for their 2024 benefits, it will cover you for 2023 and 2024. I'm hoping that's right. Anne-Marie, you can check me on that in a minute, but that's basically what's happening there is when they roll out their 2024 benefits, it will allow you to sell for both the current year and the year coming up. So that is what's going on. Also want to share with you the recertification link. So the very first link that you see here on the gold key, and remember the gold key is your knowledge center. I put it in the chat here for the link. You're going to click that, and here's all the recertifications. Okay, I've got AHIP up here. If you haven't done your AHIP yet, please get that done. It's been out for a month now, and you've got a $50 discount. You can click that link to get it. If you sign in, you can sign in with your previous carrier, whoever you got the discount from before. Here's all the instructions. I've uploaded all the module training sessions there. So these are the actual slides that are used in the training. You can use those as a reference. Also for training and for studying, right? You can get the ACET AHIP test, okay? Once you get done with the AHIP, you have to go out and do a recertification for the carriers that you are currently contracted with. If you are not currently contracted with one of these carriers, please reach out to contracting@askhpm.com. Contracting@askhpm.com, or just call us or ask a team member. We're here to help, okay? So for instance, if you're ready to do your Healthfirst 2024 recertification for Medicare, you're going to click that and you're going to see, oh, wow, there's the broker bulletin that they did. These are the instructions. Here's the link to the portal. Here's the guide to get started. Here's the phone number. Here's the email to broker services. If you have any questions, it's all here for you to get started in your 2024 recertification link. Okay. So don't want to forget that. Very, very important that we get those certifications and trainings done. Speaking of, Angie just posted also, just a reminder for the Breakfast with Devoted on Wednesday, the 26th at 10 a.m. That is at the Dedicated in Winter Park. I think that was on the calendar. Nope, looks like it was, well, maybe it was, no, it's there. Thank you, Angie. You already got it. All right, moving on. We've got, okay, quick update here. Last month, we had talked about a notification that came in from United Healthcare. And United Healthcare had sent out letters to those folks that are living in the Central Florida area regarding Orlando Health and their termination of their agreement, which means that Orlando Health will no longer be in network for United Healthcare across all lines of business, which include Medicare, ACA, group health, the whole 9 yards. And that includes Orlando Health's hospitals, primary care doctors, specialists, entire organizations. As of today, as of this morning, they have not come to an agreement. We are at the 11th hour. It's July 24th. I would prepare to ensure that you have a game plan here for your members that are on United Healthcare and are going to an Orlando Health doctor, because this is a disruption of service. Members may need to change their plan. Members may need to change their doctor. It's best that you do it and get in front of it. So if you need help with your text messaging, your emails, your postcards, whatever it is, however it is that you want to reach out to your members, we're here to help you and supply that help, okay? So reach out to a team member and we're happy to help you with that. Okay, quick update on Cigna. They have a new transportation vendor coming out on August 1st, and that's Modivcare, 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 and that is the new transportation vendor that goes into effect August 1st. The members got letters here if they have a transportation benefit with Cigna. And this goes across the country, guys, so no matter where your members are, this is very, very important that you let your members know, especially if they're accessing the transportation service, which is very, very important. All right, and then one last update before I hand it over to our special guest, Anne-Marie at Healthfirst. She's going to give us the update on what's going on at Healthfirst. One quick update, we have our annual AEP kickoff. We're calling it a tee-off this year because it's going to be golf-centric in the theme. And as a reminder, this is a save the date, if you will. I just want to get this out there. It's on Friday, September 22nd at 3 p.m. And we're going to go as late as 10 p.m. so you can hang out with us all afternoon, all evening. We're going to feed you. We've got drinks. We've got prizes. Nobody leaves empty-handed. We've got knowledge, which is the most important thing. We've got vendors. We've got networking. We've got friends. We've got family. It's going to be a blast. So if you haven't yet registered for this event, you can pre-register for it in the chat. I just dropped the link there. You can go ahead and do that. But we will be sending out save the dates as well as the official invitation in the mail as well. This will be limited to 100 guests. So last year we had to turn people away. I'm hoping we don't have to turn you away. So please make sure that you register early and often. and so that way we can save your seat. Guys, we don't want to guilt you into coming to these events. Although we're bringing massive value, please don't falsely give us an RSVP if you know you're not coming. This does damage to our partners. It does damage to the environment, because if you say that you're coming, we're going to prepare food, we're going to prepare gifts, we're going to do a lot of things to ensure that you have a great time. And if you don't show up, it's a waste of resources, and our partners don't like that. Okay, so if you're not coming, just let us know. That's all we ask. Okay, don't tell us you're coming. All right, with that, I have a special guest on the line. We have Miss Anne-Marie Chapman from Healthfirst. Good morning, Anne-Marie. Can you hear us?
I can hear you. Yes, can you hear me?
Yes, I can. Fantastic.
Excellent.
We've connected, and Anne-Marie and I have been chatting quite a bit over the last month, maybe 2 months, about strategy, and we had a fantastic lunch with leadership there. And she has some exciting news for you guys today. And so I'm going to go ahead and turn it over to you.
Yay!
Thank you.
Yes, very exciting. Long time in the making. Can I share my screen, Justin? Is that okay?
Absolutely. Let me go ahead and fix that up for you.
Okay.
Do that. All right. You should see an option on the bottom that says share.
Okay. Let me see if it was okay. So I am a little technically challenged. So let me
Take your
see
time.
if I can. Let's see what I've got here. Oops, let me bring up the PowerPoint first. There we go. Is that? Okay, here we go. This is what I want to share. Yay!
All right, we got it. Thank you very much.
Excellent. Thank you. Yes. So big news with Healthfirst. I'm going to give you a very brief presentation. So overview of individual and family plans for health plan markets. So I'll talk about us, but I'm going to save the big news. Some of you probably already know it, but it's coming soon. So Healthfirst Health Plans, if you don't know us, you want to get to know us. We were formed in August of 1995 over here on the Space Coast. We're an integrated delivery network. We own 4 hospitals over here. And we also have a really close relationship with Advent Health. So we've got over 4,000 providers across Central Florida and the Advent Health hospitals as well. Currently, we are sitting at 62,000 members in Medicare Advantage and individual. Wellness starts with we. That is one of our new taglines. We went through a little rebranding last year. So I'm going to talk about us. Well, I just talked about us. And next thing is expansion and network guide. So that is the big news today. And then I'll talk a little bit about our portfolio and selling points. So, okay. So again, for individual and family plans, we started in 2013, just at the dawn of the ACA, we got into the individual space, and we spent the first year doing underwritten plans. So that was fun, not. And in 2014, we partnered with Advent Health. We expanded into additional counties. And that number is wrong. We're actually over 30,000 individual members, both on and off marketplace in our 5-county region. So here we go. This is the exciting news. We are going to have an expansion for 2024 into 5 additional counties. So currently, all where you see the purple, the Flagler, Volusia, Seminole, Brevard, and Indian River, those are our current selling areas. We are moving out. We are going to Lake, Orange, Osceola, Polk, and Pasco. So we're very, very excited about this. This has been a long time coming. I know that Justin is excited about this. We've been talking about it for years, and I've been saying, hey, Justin, we're coming. And then I've been saying, hey, Justin, just kidding. But we're not kidding this year. We are finally expanding, and we're very excited about it. This is all with our partnership with Advent Health. For those of you that don't know, Advent Health actually has an interest in Healthfirst. They are about 27% ownership of Healthfirst. They have a couple of board members on the Healthfirst board. So we have a very close relationship with them. And so our intent is to expand wherever their footprint is. So this is where we are going, and we're very excited about that. So what are we going in there with? So right now, and I don't know that this is going to change a whole lot, but we have gold plan, obviously 5 gold plans, 3 silver plans, 6 bronze plans. We do also have 3 value plans that are offered in Brevard County only, so that if you do have any clients in Brevard County, they have an option of a plan where if they just use the high value network that is primarily made up of the Healthfirst providers, they actually will have some cost savings when they see those providers. We also have 1 catastrophic plan that must be enrolled through the marketplace. If you're 30 or over and meet the criteria for catastrophic, I believe if you're 30 or younger, you can still do that through Health Sherpa. And we do have 1 silver plan that is offered only off marketplace. Other than that, all of our plans can be offered both on and off the marketplace. So some selling points for Healthfirst. Right now, we are very competitively priced in all the counties. Now, we just put the filing in for 2024, and we are being told that we are looking like we are still going to have a really good price point, even in our expansion counties. So we expect to be very competitive with our prices. I will also say here too, because I know that there is always a concern whenever a new carrier enters a new market, that they are going to come in with really low prices, get all the membership, and then the next year there are going to be some really hefty rate hikes. I can tell you that Healthfirst is very, very conservative. We have a conservative CFO. We do not buy business. So our prices are going to be competitively priced, but they will also be appropriately priced as well. So with that being said, some of our other selling points are we have an open access HMO plans. That's what our plans are. So there's no referrals to see a specialist. As long as the client goes to a provider that is within our network, they can just make the appointment and go. Now, there are some specialists that will require a referral. So there might be a cardiologist or a neurologist who wants to make sure that you've gone to your primary care to rule out any other issues that might not be, cardiac or neurology. That is up to the provider. But as far as the health plan goes, we do not require a referral. We have over more than 4,000 providers in our network and growing. And then our partnership with Advent Health, like I said, they own a portion of Healthfirst. They are invested in our success. So that is one of our selling points as well. We have worldwide urgent and emergency care. I understand that some of our competitors are only national. You're only covered if you are, here nationwide. But if you're traveling, if you're on a cruise ship and you have urgent or emergency care, you are covered for that as well. We do offer $0 gym benefits on select plans. That is through Active and Fit. And I think the last two are really, really important points for Health First, is that we are headquartered right here in Brevard County. Our team lives right here in Central Florida. Our CEO lives in Florida. We're not a big company that has come in from somewhere else. We live among our broker partners, among our members. So we're really invested in the success of and the satisfaction of our members. And we're also not for profit. So any of the profit that is earned from Health First goes back into our hospitals, into our doctors, and into our community. So we're not answering to any shareholders as well. So, and with that, oops, sorry, this is from an older, I'm not going to go over those, that was from an older presentation, but this is our website, myhfhp.org. And with that, I think I am done.
Outstanding. So just really quickly, we have a few folks that are on the call that may not be doing ACA at this time. If you are interested in learning more about how to do ACA in general, we are going to be doing some classes and trainings. But in the meantime, you could reach out to us and we can get you through the basics. We have a guru on staff, Mr. Victor Crumity, who has been there from day one. As of 2010, he started doing ACA along with myself. And so he is probably our best resource when it comes to training. So if you're interested in getting started with ACA, a couple of main points is there is one annual test that you have to take every year, which is the FFM training, Federally Facilitated Marketplace Training. And then you just contract. So for instance, you contract with Health First, but Health First does not require you to do an annual ACA training. Okay, that's included with the FFM. So if you're concerned about, well, I got to do all these Medicare trainings, yeah, that's a thing, we get it. But if you add ACA, you're only adding one additional test per year, and then you can contract with the carriers that offer ACA products. So don't be intimidated by the amount of work that goes into getting started with ACA, because there are several folks now that are doing extremely well with ACA, to the point that they don't really want to do Medicare anymore. There are people that are earning extremely high bonuses, and then that annual or that monthly income that comes in every month is immediate. So if you sell policies, for this month because you have an SEP, you get paid next month, and so on and so. Very easy and quick way to start earning money without having to worry about chargebacks and things like that. So just super high level that I wanted to mention to those of you that aren't currently doing ACA. With a partner that's expanding in the Central Florida market, this might be an awesome opportunity for you to get started with some folks that are going to be very hands-on. So just wanted to say that. If you have questions, guys, go ahead and post them in the chat here. Happy to answer any questions there for Anne-Marie or myself or whatever you might have. And Anne-Marie, this is a question for you. I know we didn't talk much about plan designs for 2024, but are you guys looking at adding dental options or tagging some dental together with some of your plans, or is that separate? Or can you talk a little bit more about how the ACA products are going to work for Health First for, maybe adding some additional dental benefits?
Yeah, so actually we're not looking at adding any additional dental, Justin. We do have the pediatric preventive dental in there, but as far as what we offer for adults, we are not offering anything additional for 2024. I expect that our portfolio will look very, very similar to what it does this year. We may sunset a few plans, and I think, CMS is requiring that as well. But I do think that our plans will be competitive. One other thing that I did want to mention is we did launch a $0 medical deductible bronze plan for 2023, and that is our fastest growing plan. It is competitively priced. The copays are excellent. So that is one of our good plans that is selling quickly as well.
Awesome. Mary has a question in the chat. She says Seminole County dropped with Healthfirst in 2023. Any chance coming back? And I know you probably need to give some context to that question. So
yes. Yeah.
Okay, go ahead.
So Seminole County dropped for Medicare only. And the reason that it dropped was we expected to do this expansion in 2023. And some of you may know that we had a little bit of a partnership issue in 2022. We had partnered with Plus Oscar for the Oscar technology. That partnership unfortunately did not go as planned. So what was happening at that time was we were expecting to expand both individual and Medicare. And when we filed for Seminole County, we were going to relaunch Seminole County as an expansion county. So when we decided to pull back on the expansion, Seminole got it was collateral damage. So it's considered an expansion county. And so we will expand back there with our Medicare products. We are planning on expanding the Medicare products into the same footprint I just showed you for 2025. So again, that will all be subject to regulatory approval. Even this expansion is subject to regulatory approval. We don't see any issues with it, but we are not the regulators as well. So yes, we will be coming back to Seminole County.
Okay. So just to be clear on that, for Medicare, when you're coming back for 2025, not 2024, for Medicare in Seminole County.
Yep. So this is 2023. Right. So Medicare would be 2025. The expansion that I gave you today was all IFP. It is not Medicare. Yes.
Yeah. So yeah, that answers your question, Mary. They're shooting for 2025 back into Seminole County for Medicare, but they're currently there for ACA already. Yeah.
Correct.
Got it. Just want to make sure we don't have any confusion because that does get a little confusing there.
It does.
Okay. Thank you for the question, Mary. Doesn't look like we have any other questions for Healthfirst. So with that, we're pretty much at time. Anne-Marie, thank you very much for your time this morning and the information. I think you did a record speed presentation and it was amazing. So
I had a lot of information that I wanted to do really quickly. And I appreciate it. Thank you for having me, Justin. And thank you. We're really, really excited about this expansion.
Absolutely. And I'm sure we're going to do some more in-depth sessions in the future that we can pre-record and ensure that the agents have it at their fingertips. And I'm also pretty sure you're going to be doing live rollout sessions as well around the open enrollment time. So we'll keep everybody abreast. Just make sure you get those over to us so we can put them on the calendar like you saw this morning. And then we can advertise them for you to make sure that everybody knows where these events are. So again, if you have any questions for Anne-Marie or any of the team here, or if you'd like to get started with Healthfirst, please reach out to contracting@askhpm.com or reach out to a team member here and we'll get you set up with Anne-Marie and the team. So thank you guys very much. Cindy's saying that the benefit advisor meeting for Thursday has been updated on the calendar. If you don't have the calendar, same thing, just reach out to a team member and we'll be glad to get you that calendar so you have it on your phone, laptop, and iPad so we can stalk you. No, I'm just kidding, to make sure that we got what you need. So thanks again, Anne-Marie. We appreciate your time. Everyone else, thank you guys for being here and getting the information first. Remember, if you miss a session as we go into AEP, no big deal. We are hosting these on YouTube, so you can check back on the information in case you missed something good. With that, I wish you a very successful and prosperous week. Take care, guys, and good luck.
Thank you, Justin.
Thanks, Anne-Marie.